Hello, everyone. My name is Dr. John Adib. I'm with the Preventive Medicine program at the University of Rochester School of Medicine. I'm presenting this roadmap to men's health screenings on behalf of the Center for Community Health and Prevention. Due to the COVID-19 pandemic, I'm sorry that we couldn't meet in person. Please feel free to reach out to me if you have any questions. My contact information is at the end of this presentation. Here's some of the resources that we aggregated from in this presentation. The overall majority is from the United States Preventive Services Task Force. As always, please consult your personal physician for any individualized screening plan. In this presentation, I will offer you a roadmap to help you guide you through some of the basic screenings and vaccinations that your healthcare providers will want you to take in different decades of life. My hope is that you will have a map to get a sense of where you're going. As a roadmap to health screenings. As with any journey, it is good to prepare and pack wisely before you go on it. Having your health history at any annual exams and preventive visits will help your doctor make better plans for you. If he or she doesn't ask about these, then let them know your medical and surgical history. Are you a smoker or a drinker? Have you been in the past? Are you currently? And any current or past medications you take routinely. This is all important information that can help them develop an individualized plan. Also, the most preventable cause of death in the United States is smoking. If you're dead set or on the fence about quitting smoking, I strongly recommend that you give that New York Quits phone line that I have here in this slide a try. Life begins at 20. The last 19 years have just been a practice. A little bit of levity as we go through the decades here. This is a men's health lecture, and technically you start becoming a man at age 18, but we went ahead and rounded up to start at age 20. So the first stop on your preventive journey will be your 20s, where you will have regular eye exams, hearing exams, blood pressure screenings laid out at intervals. Each of these tests rules out an ailment as listed above. Skin exams and testicular exams are always controversial. We live in an era of COVID-19 pandemic. Getting regularly scheduled vaccinations is advised. You'll find that a lot of recommendations for these tests carry forward into later decades of your life. Men are more likely to get skin cancer than women. Your risk increases as lifetime exposure to sun and/or tanning beds accumulates. Sunburns accelerate this risk. Examine your skin on a regular basis. A common location for melanoma in men is on the back, but check your entire body for moles or suspicious spots once a month. Start at your head and work your way down. Check the hidden areas between your fingers, your toes, your groin, soles of the feet, the backs of the knees. Check your scalp and neck for moles. Use a handheld mirror or cell phone, or ask a family member to help you look at these areas. Be especially suspicious of any new moles. Take a photo of the moles with your cell phone, add a date on there, and that can help you monitor them for change. You want to employ a technique called the ABCDs when trying to figure out if a mole is abnormal. A stands for asymmetry, which means if you split the mole in half by drawing a line down the middle, the two halves, as we have in this picture, it would look different between the two halves. B stands for border, so an irregular border is more cancerous. C is for color, and if the mole is different colors, you can see different colors to it. As you can see within this mole right here, you get different levels of red and black. D is for diameter, which means it's bigger than the pencil head. So as you can see, as it's measured out here, it's very big. Correction, I meant pencil eraser, not pencil head. Here's a prevention tip. Limit your sun exposure, cover up, and don't forget to cover up your lips and ears. Wear SPF 30 sunscreen. There are some other types of skin cancer that you should be aware of. Melanoma, which is the most deadly. Squamous cell carcinoma, it often appears as a scaly growth or sore that doesn't heal, as you can see in this picture. Basal cell carcinoma often appears as a waxy and pearly bump on the neck, ears, and face, often even times the nose. The 30s are the new 20s. We're on to the next decade. Considering how many of the screening tests in your 20s are repeated in your 30s, that's a good sign, at least medically, that your 30s are much like your 20s. Except for the addition of cholesterol screening when you turn 35, some may get screened at a younger age if you have a family member with a history of high cholesterol or a heart attack and stroke in the 50s. This test is often a simple blood draw done after 8 hours of fasting, and it tells you a lot. What is cholesterol? It's a waxy-like substance that preserves food and makes things stiffer. Ever found a McDonald's French fry preserved under your car seat months later and it doesn't look like it's molded or changed at all? That's because it's full of cholesterol. This waxy-like substance can form plaques on your arteries, as you can see in this picture. These are little plaques right here that are forming. And they can narrow the spaces. They can restrict blood flow, causing pain. As you can see in this gentleman right here, he's feeling pain in his leg. Or they can form clots in the brain, as you can see here, which we call a stroke. Or they can form clots in the heart, causing a heart attack. LDL is the bad cholesterol that forms these plaques. So there's LDL, and it's forming alongside this arterial wall here. When people get their cholesterol levels back, they often have a hard time reading or understanding them. The most important numbers are the LDL cholesterol and non-HDL cholesterol. As you can see here in this diagram, I have listed off the ranges here for you so you can get an idea of where your normal should be and what puts you at high risk. Remember, the LDL is the most is one we consider significant importance for increased cardiac risk and cerebrovascular disease. You always want to reduce your cholesterol to prevent those plaques, heart attacks, and stroke. Lifestyle changes like a healthy Mediterranean diet, physical activity at least 30 minutes a day, and weight loss help lower cholesterol. Stopping smoking helps lower your risk of heart disease, stroke, and many more illnesses. If these fail, there are other interventions such as medications that you can take. An uplifting reminder that turning 40 is awesome. So we're on to the next decade. The new tests in this decade are diabetes tests and screening for colon cancer for those at increased risk. It's recommended that anyone overweight or obese, that is having a BMI greater than 25, gets screened for diabetes every 3 to 5 years. This blood test is called the hemoglobin A1C. It's an easy test that you can just do one time. How to interpret your hemoglobin A1C diabetes screening blood test. As you can see, the normal is anything below 5.7%. Everything between 5.7 to 6.4% is something we call pre-diabetes, in which many of the changes are reversible. And then diabetes is anything 6.5%. Here's another way of interpreting it. Notice that it can cause a lot of damage to other organs like heart attack, stroke, puts you at increased risk for a lot of other organ problems. So when you hit 45, and if you're increased risk of colon cancer, we have to start screening you. Now, this is different for different people. If you have a family history of colon cancer, it's best to talk early with your doctor about when you should get screened. Oftentimes, it's either the age of when one of your primary relatives was diagnosed with cancer, colon cancer, or 10 years before the age of when your primary relative was diagnosed with colon cancer, or 45, whichever comes earlier. The big thing about colon cancer is that early detection can be curative. Colorectal cancer is the second leading cause of cancer-related deaths. Mortality is higher in men than in women, and more cases of colorectal cancer are found in men. Screening can save lives. Many don't have symptoms, and don't wait until you start to feel sick to get tested. That's the key thing there. This is another slide, shows that 50,000 people are expected to die of colorectal cancer every year. Screening could save half of those lives. Once again, screening saves lives. Here's the outlook for when you should get tested. Most people are tested between the ages of 45 and 75. After that age, after you turn 75, you may want to consult with your physician if you need to be tested or not. It's going to be different case by case. There's one thing I can make you walk out of here today with is that screening can save lives. In this case, 60% of colorectal cancer deaths could be prevented with screening. There are multiple ways to screen for colon cancer. We can use a scope or a colonoscope to visualize and treat at the same time. This colonoscopy is the gold standard. As you can see, oops. We can use a scope to visualize and treat at the same time. You do have to take a bowel prep, which helps optimize, visualization and but most people tolerate those well. You can get a virtual CT scan as an alternative, and you can give a stool sample. The biggest difference between all these different types of screening is that how often you have to do it for follow-up, and less intervals are achieved with the scopes. Here's a diagram that will show you kind of what I'm talking about. Yeah. So as you can see, like when you have when you take the stool samples, it's done yearly, and then the Cologuard done every 3 years with the DNA test from the stool sample. So 1 to 3 years, every 1 to 3 years with the stool samples. But with colonoscopies, you can just do it once, and then you're set for 10 years potentially, unless they find some polyps or something they want to monitor. Sigmoidoscopy has their own ranges. So as you can see here, this is what a normal colon looks like when under colonoscopy. As you can see in this middle slide, we have a polyp, and then which is like an outgrowth. And then as you can see, the irregular borders of this right here is the colon cancer tumor itself, and it's looking like it's going to grow in all which directions. The goal is to get it removed early when it's in this stage, before it becomes this bad and uncontrollable. This can obviously go through the wall of the colon and have metastasized or grown in other parts of the body at this point. So, and it takes years for it to go from here to here. So you have an advantage of, you monitor frequently, throughout the years. If you keep up with your screenings, you can watch for this growth and stop things before they get bad. Once again, this is an example of how screening and treatment can be done at the same time, and as you can see, this is how you remove a polyp. It took 50 years to look this good. Under the 50s. For average risk adults, colon cancer does start at colon cancer screening starts at age 50. Prostate cancer screening is controversial, and we suggest you discuss with your physician on how you want to do that. Lung cancer screening is done if you are at age 55 to 80 years old and smoked a pack per day for 30 years, and you currently smoke or quit in the last 15 years, then you should get a CT lung scan for lung cancer. So that's a lot of words there. Here, let me try to explain using this diagram. So if you are age 55 to 80, and you have a heavy smoking history, so a pack per day for 30 years, or 2 packs per day for 15 years, anything that equals what's called a 30 pack years. And then you smoke now or quit within the past 15 years, you may want to consider getting one of these annual CT scans for lung cancer, so they can find nodules or find cancer when it's small before it spreads and treat it. Apparently, 7 out of 8 adults who meet this screening criteria did not actually get the screening. So there's a lot of people that don't know about this, maybe, or don't know that they can get this. It's kind of newer, and I think it would be really helpful for a lot of people. As you can see, all it is you just sit in the CT scan, and they can help find the nodules. Not very invasive at all. I'm not aging, I'm increasing in value. So if you reach the 60s and over, you're not aging, you're increasing in value. And so the big thing is if you reach your 60s and you've ever smoked, you want to make sure that you get screened for an abdominal aortic aneurysm at age 65. What is this? So this is the aorta right here. It's a big artery that comes out of your heart. It's the biggest artery in your body. Over time, it can bulge and it gets nicked by chemicals like nicotine, or just high blood pressure can cause it to change shape and bulge. And we call this bulge an aortic aneurysm. Anyone who's ever smoked has an increased risk of having one of these, and these get big. Usually greater than 5 centimeters. They have a risk of rupturing or being dissecting is what they call it. And you can get an aortic dissection, which can cause life-threatening bleeding, and unfortunately can lead to death. So, but now that what we recommend is that you get a one-time scan at age 65, a very non-invasive scan, and it can save your life. How non-invasive is it? It's this simple. This looks exactly like this. See, this woman here is holding an ultrasound device right up to this man's chest. She's going to take some imaging, and then they'll be able to go from there. Typically, depending on the size of the aneurysm, they can decide whether they want to operate or if they want to just monitor it and see if it changes. Very easy, safe, and non-invasive. One thing I was saying is you want to keep up on your vaccinations as you turn 65. Obviously, the pneumonia vaccine is important to prevent you from getting all of the different types of vaccines, pneumonias that are out there. Not all of them, but at least some of them. But the chickenpox virus also is something that people don't realize comes back. It never really goes away when you get it when you're younger. It kind of hides in your nerve cells, and so this resurgence of the chickenpox virus, although not deadly, it can cause a lot of pain when it comes out on your nerve cells. A simple vaccination can boost your immune system and prevent you from getting it, or if you get it, it lessens the effect of it. So it's something that people always, I've seen people turn those down, or I realize how the importance of that. I hope this is helpful. Thank you for listening. If you have any questions, please feel free to contact me by email. I've also put my Twitter here if you're savvy with that. I wish you all a happy day, and thank you.